The prostate is a walnut-shaped gland that is part of the male reproductive system. The main function of the prostate is to make a fluid that goes into semen. The prostate goes through two main growth periods as a man ages. The first stage occurs early in puberty when the prostate doubles in size. The second phase of growth of the prostate gland begins around age 25, and continues during most of a man's life. Benign prostatic hyperplasia often occurs with the second growth phase. In hyperplasia, the wall of bladder becomes thicker. Eventually, the bladder becomes weakened and loses the ability to empty completely, leaving some urine in the bladder. Benign prostatic hyperplasia is the most common prostate problem for men older than age 50. The cause of benign prostatic hyperplasia is not well understood, however, it occurs mainly in older men. Benign prostatic hyperplasia does not develop in men whose testicles were removed before puberty. Throughout the life of men, they produce testosterone, which is a male hormone, and small amounts of estrogen, which is a female hormone. As men grow older, the amount of active testosterone in their blood decreases, which leaves a higher proportion of estrogen, which increases the activity of substances that promote prostate cell growth. Another theory focuses on dihydrotestosterone, a male hormone that plays a role in prostate development and growth. Scientists have noted that men who do not produce dihydrotestosterone don't develop benign prostatic hyperplasia. It rarely causes symptoms before age 40. The occurrence and symptoms increase with age. Some factors in men may contribute to produce benign prostatic hyperplasia, such as age 40 years and older, family history of benign prostatic hyperplasia, medical conditions such as obesity, and diabetes. Lower urinary tract symptoms suggestive of benign prostatic hyperplasia may include frequent urination, urgent need to urinate, dribbling at the end of urination, urination during sleep, accidental loss of urine, urine that has an unusual color or smell. A healthcare provider diagnoses benign prostatic hyperplasia based on a personal and family medical history, a physical exam, medical tests. Treatment options for benign prostatic hyperplasia may include lifestyle changes, medications, and surgery. Men may not need treatment for a mildly enlarged prostate unless their symptoms are severe and affecting their quality of life. A healthcare provider may recommend lifestyle changes for men whose symptoms are mild or slightly bothersome. Lifestyle changes can include reducing intake of liquids, particularly before going out in public or before periods of sleep, avoiding intake of caffeinated beverages and alcohol, avoiding or monitoring the use of medications such as antihistamines, antidepressants, and diuretics. A healthcare provider or urologist may prescribe medications that stop the growth or shrink the prostate, include alpha blockers, phosphodiesterase 5 inhibitors, and 5-alpha reductase inhibitors. Alpha blockers. These drugs include paroxetine, doxazosin, and terazosin. These medications relax the smooth muscles of the prostate and bladder neck to improve urine flow and reduce bladder blockage. Phosphodiesterase 5 inhibitors. These include tadalafil. Urologists prescribe these medications mainly for erectile dysfunction. 5-alpha reductase inhibitors. These include finasteride. These medications block the production of DHT, which accumulates in the prostate and may cause prostate growth. Researchers have developed a number of minimally invasive procedures that relieve benign prostatic hyperplasia when medications prove ineffective. They can destroy enlarged prostate tissue, which relieve blockage caused by benign prostatic hyperplasia. These procedures include transurethral microwave thermotherapy, high-intensity focused ultrasound, water-induced thermotherapy, prostatic stent insertion. For a long-term treatment of benign prostatic hyperplasia, a urologist may recommend removing enlarged prostate tissue or making cuts in the prostate to widen the urethra.